Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Welcome to our podcast segment on addiction and behavioral health. Today, we'll take a moment to explore a common experience many people face: drinking more than planned. This discussion is intended for educational purposes only and is not medical, psychological, or professional advice. Many people have experienced moments when social situations feel easier with a drink in hand. It's not uncommon to find ourselves at gatherings, perhaps with friends or family, and before we know it, we've consumed more alcohol than we originally intended. This phenomenon, where someone drinks more than they planned, can happen in various settings and does not automatically indicate a severe alcohol problem. When we talk about drinking more than planned, we're referring to situations where an individual consumes a larger quantity of alcohol or drinks for a longer duration than they initially intended. This could mean having 5 drinks when the plan was to stop at 2, or staying out until 1 in the morning when the goal was to be home by 10. It's important to understand that this behavior is just one data point in the broader context of an individual's relationship with drinking. There are some common misunderstandings surrounding this topic. For example, many people believe that drinking more than planned automatically signifies a severe alcohol issue. However, this is not necessarily true. It is one factor among many that professionals consider when assessing alcohol consumption. Additionally, experiencing this once does not guarantee that it will happen again. A single instance doesn't predict a pattern of behavior. It's also important to note that exceeding a drinking plan does not always lead to negative consequences. While there can be situations where drinking more than intended results in adverse outcomes, this is not the case in every instance. The impact of such behavior can vary significantly depending on the individual and the context. Understanding these nuances is crucial, especially within recovery communities and broader public health discussions. Recognizing that drinking more than planned doesn't equate to an immediate diagnosis of an alcohol use disorder can help reduce stigma and facilitate healthier conversations around alcohol use and recovery. For those exploring careers in substance use disorder counseling or behavioral health, understanding topics like this may help prepare you for the complexities of human behavior related to alcohol. It opens the door to deeper discussions about patterns and the factors that contribute to them, fostering a more compassionate approach to those seeking support. As we wrap up this segment, remember that discussions about drinking behaviors often arise in addiction counseling education. Programs at institutions like InterCoast colleges delve into these topics, providing valuable insights into behavioral health and recovery support. If you'd like to learn more about education pathways in this field, you can visit intercoast.edu. Thank you for joining us today.
If you or someone you care about is struggling with mental health or substance use, help is available. You can contact the SAMHSA National Helpline at 1-800-662-HELP. Available 24 hours a day, 7 days a week, free and confidential, in both English and Spanish. You can also call or text 988 to reach the Suicide and Crisis Lifeline anytime. And if you're looking for treatment or support services near you, simply text your 5-digit zip code to 435748. That's HELP for you to receive local resources. Reaching out is often the first step toward recovery, and support is available whenever you're ready.